if you could just talk about the vaccine that you received in, and I know that you're one of the only hospitals in the area that has the capability of keeping the visor.
Right.
So if you would just talk to me about that.
Okay. Well, when we started to develop our programs for COVID here, one of the things, because we're, again, one of the few hospitals in this area that actually does the PCR COVID test in-house now, and that's the highest level of COVID test you can do. And we invested into that. And part of that, because the way our controls for that equipment has to be stored at a minus 80 degrees. So we went out and purchased back 6-8 months ago a freezer that could handle the minus 80. So when the Pfizer vaccine came out, although we got the Moderna this time, we're still in a position that we can receive the Pfizer because we have those freezer capabilities to store that vaccine in there. So, we got our shipment of Moderna today, about 300 doses of it, and we're excited to be able to start getting that out to our employees and to our residents on the 3rd floor.
Well, you've got 300 doses now. Is that enough to cover the staff?
Well, what we are working with the health department on. That should be enough to cover our staff. And what the state has done is we have to daily submit information to the state. And what they did is calculate the number of employees that we have plus 15% to be able to start working with community health providers that are out there in the community that are frontline healthcare workers too. So we'll be working with the health department to get that process going also.
Okay. Well, with other smaller hospitals not having the capabilities that you do, should they get in the visor product, would you be storing it for anyone else, or how does that?
We could, and that's a possibility. We could store it for them. We've been approached by a number of facilities to do that for them. Of course, our priority is always Washington County and Northwest Florida.
Right.
But we've agreed that if they would get the Pfizer vaccine, that we would be willing to store that for them. So.
Okay. Let's see. I was trying to think what other questions I might have for you. Now, this being the first shipment, but will you be getting other shipments in working with the health department to get that out?
Well, everything will flow through what they call Florida shots.
Okay.
So everybody that gets a vaccine their information will be included like any other vaccine into the database of Florida shots. And then your subsequent shipments will be based upon how many you've used, how much you have, and then at what stage of where we are vaccinating, because the CDC and the state have set specific guidelines on, the first batch, which we're doing today, is for healthcare workers and long-term care residents. The next phase will probably be, first responders, other, frontline EMS first responders, those types of individuals. Then it will go down to, they set the guidelines for us, if you want to say, as to who's next in line to do that. Now, if we would happen to have more vaccine than what we need, we could go and start moving down that list to other people to start getting it up, even further.
Right. Well, that's good to know. I'm glad to hear that the 3rd floor and those residents are going to be taken care of first.
Well, the biggest thing that you can do, as far as being the press is to promote this, because there is a segment out there that are fearful of it, that are afraid. I mean, there's people that are still afraid of the flu vaccine.
Right.
But the only real way we're going to be able to get starting to make an impact on this pandemic is by having this vaccine. It's been tested by thousands and thousands of people and proven to be 95% effective.
Right.
So, the thing that we need to do, and why we invited, you all here today is to try to get the word out that when it's their turn to get the vaccine, that people need to get it, because, this isn't going to stop it tomorrow in Washington County, because we've vaccinated so many people here. But it's the start, and if we don't start somewhere, we'll never get ahead of this.
Right. Right. Well, having grown up in the era of getting the polio vaccine.
Right. That's what Dr. Clemens and I were just talking about, remembering back when we get the polio vaccine and the little sugar cubes with the stuff on it, and but it's the only way that we're going to be able to start to get a handle on this and try to get, our lives, our society, whatever, back to normal.
Right.
And it's we're excited to be able to do that.